Hi, Sophie Hawkins here, and wanting to talk to you about sciatica and Piriformis Syndrome. So true sciatica is two vertebrae in the back that are pinching on a nerve that comes down through it would come out of the vertebra in the back, and the sciatic nerve runs down through this area here where the piriformis muscle is. So when that piriformis muscle gets really tight, it can also pinch on that sciatic nerve. So what a lot of people call sciatica, it's the similar kind of pain down the leg or right in this area of the hip. Sometimes goes down the side of the leg, the front of the leg, but or the back, that pain is actually caused most frequently by this tight piriformis pinching that sciatic nerve that's coming from the back. And so there's not actually a pinch or a constriction of that nerve coming out of the spinal cord. So coming out of the spinal cord, if it's constricted at the vertebra, then that is true sciatica. When it's the piriformis muscle pinching that nerve, it's actually called Piriformis Syndrome. Now, how does the Hesch Method relate to that? Well, particularly, there's several different misalignments that can cause this piriformis muscle to be really tight and impinge upon that nerve. One of them is a hip out to one side. So if you can imagine that your whole pelvis is a little bit shifted, or that the hip bone is shifted out to end range, then it's going to pull on that area where that sciatic nerve is coming through and make that piriformis tight on that side. Generally, it's on the right side of the body, but it could be on the left. Another common pattern that happens that we treat in the Hesch Method is a downslip of the ilia. So it's when this whole side slips down a little bit, and then again it will pull on that muscle, making it tight, and then that will impinge on that sciatic nerve. There's other misalignments that get more complicated, but those are two very straightforward common ones. There's another pattern that I'll talk about in another video called a wind-swept pelvis, and that also can cause a constriction on the sciatic nerve. So often we treat these misalignments, move the pelvis back to where it's straight, and that pain just seems to magically go away. But really it's because we've now lessened that discomfort, that pulling on that piriformis muscle that's pinching on the sciatic nerve. Sometimes if it's been a pattern like that for a long time, that's where having a massage where you're actually treating those muscles and sometimes the muscles throughout that whole low back area can be very helpful. So I do really like to do a massage before the Hesch Method if that's at all possible. Sometimes the person's in so much pain, I just want to go right and treat that right away, and then do a bit of massage to loosen up the muscles, give the person more, a little more relief than they might get with just one or the other. But definitely my priority is always to straighten the pelvis, because that's a long-lasting treatment that then the person can do at home, so they never have to feel that pain again. So that's the best case scenario. Hopefully there's nothing in the way of making that correction to the pelvis. And I've seen in many cases where sciatica, the person they can manage that at home, they no longer have that pain, which can be extremely debilitating, as anyone who has ever had that pain knows. Once you've experienced that, it's like a toothache in your butt or a toothache down your leg that nothing seems to help. So I really like treating that condition because it is so straightforward, often with the Hesch method, and we can get some really good results in a very short period of time. Thank you.